When do I shift from caregiving to care supervision? You used to be hands-on, doing the feeding, bathing, transferring, but now something's changed. Every move feels a little riskier, and you catch yourself thinking, maybe it's time that I let them do more and I do less. This shift doesn't mean giving up. It means protecting both of you. Today, we're going to explore how to recognize the moment when caregiving by doing is no longer safe, and you need to shift towards supervision, support, and delegation. You're going to hear some signs, mindset shifts, and how to lead that transformation responsibly. I'm Dr. Anna Thomas. I'm a physician, TEDx speaker, and founder of Life Care Leadership. Here we talk about transitions, systems, and safety. I created the podcast, The Age of Caregiving, to give caregivers like you the tools, structure, and support to lead care with clarity. Whether you're navigating a new diagnosis or juggling care on top of everything else, you're not alone. Please remember that everything I share here is for educational purposes only. Always consult your healthcare provider for personal medical advice. If the weight of doing it all is wearing you down, if you're feeling stretched thin and overwhelmed by caregiving, then please check out my free Thrive and Lead Masterclass. It's designed to help you move from survival mode into confident caregiving leadership without losing yourself in the process. You'll find the link below. Now, let's talk about why the shift matters. At some point, moving someone, helping too much, or doing every step becomes a danger, not just for them, but for you and for your body. Continuing doing past that point can lead to injuries, burnout, and mistakes. Switching instead to doing more supervision and collaboration lets you maintain control while reducing risk and guiding care safely. Here are some key indicators that it's time to shift. You want to look for your own physical health. If you're feeling pain, stiffness, chronic soreness after routine care, or if you are hesitating before lifting or assisting because you're afraid that you might injure yourself. If you notice more near misses or slipping while you're helping, keep an eye on those things. If tasks are taking longer and your body is struggling, if you find yourself stepping in and then having to fix it again and again, these are all signs that it might be time to reframe your role. There's a mindset shift here to think about. From doing it all to being the one who will lead the care. So you are still indispensable, but in a new way. You need to move from being the one that does the direct hands-on labor to the one that's providing oversight, coordination, and advocacy. You can guide other helpers, therapists, aides, rather than trying to replace them. You can monitor, adjust, teach, and empower them rather than doing every step yourself. That is when you become a care leader. Let's talk about how to lead the transition. Step one, you have to do an audit. What must stay hands-on? What is it that you must still own? And what can shift? So write down all the daily tasks that you do. Mark those that you can no longer safely perform. And ask yourself, which ones can the helpers that I have with the equipment that I have do while I oversee? Step two, introduce these changes gradually. So don't pull away overnight or bring in somebody they've never met before, right? Gradual introduction. Assist the supervision. First you watch, then they do. You share their responsibility, and eventually you step back to oversight. This reduces the resistance, gives everybody time to adjust. You also want to train and mentor helpers or other family. Teach them gently the safe techniques that you know so well. They've never done it before. They might need you to teach them it. You might also need to teach them what to look out for, whether your loved one is having pain or fatigue, and also how and when to communicate with you. You become a coach rather than the constant doer. Step four is to create some safety protocols and check-ins. How did that feel? Was everything okay? Did anybody have a fall? Right? Set some routines, some time that you're going to periodically supervise how the other caregiver is doing. Use tools and aids effectively to reduce those demands on your body. Let's talk about some tools and supports in this role. So make sure you have movement devices. Make sure you have movement devices or assistive gear, like a gait belt, a transfer board, or a lift chair if needed. You can also consider things like motion sensors, having additional help around, or other tools to help you with those transfers and with the daily care need. Remember that these transitions can be hard, but you don't have to be the one doing all of the work all the time, especially if your body is not able to. And if you're juggling work, life, and caregiving, and it feels like burnout is just around the corner, then check out my book, From Caregiver to Care Leader. It is a blueprint to help you balance it all with clarity, systems, and confident care leadership. You'll find it on Amazon, and the link is below. Remember, you've been the arms, the legs, and the constant presence. Sometimes stepping back feels like letting go, but it's not. It's just evolving. You're not giving up, you're protecting. Leading care doesn't end when the doing ends. It just changes shape. If you'd like to watch a little bit more and learn about tools to help you, watch this video, What Tools Make Caregiving Physically Safer for Both of Us? Because as your roles shift, these tools can become your allies. Remember, you are more than just a giver of care. You are a leader of care. This is the age of caregiving, and together we can lead it with strength, courage, and compassion.